chapter 2. And the rule of three is so important. And I find so many, you know, missing clues to a patient's injury. I'm looking for, like, if somebody pronates, they can get, about 30 different pain syndromes. Their knees can hurt, their hips can hurt, their back can hurt. They can get plantar fasciitis, posterior tib, Achilles. You can blame a ton of things on pronation, and I look at that as one. So, but why does somebody who pronates, one person has shin splints, the next person has Achilles, the next person has plantar fasciitis. So then you got to look at 2 and 3. And that's why I call it my rule of three. And always look a little deeper. I've Shin splints is a great example. I had this guy who, UCSF, I wasn't supposed to mention names, but, major university, worked up for 2 years with his shin pain, couldn't help him. He comes in, I said, he doesn't have his records after 2 years, but I say, okay, shin pain is bone pain. You pronate, I actually had good orthotics from UCSF, and I, I'm pushing on his bone, and his medial shin was killing him. I said, well, have you ever had a bone density test? And he goes, yes, one time I had a bone density test, and it was low. And I said, did anything happen to that? She goes, yeah, I think I take 400 units a day of vitamin D. Um, and so I had him get a bone density test. And at the age of 27, he had the bones of an 83-year-old. And it took him 5 years with an endocrinologist to get his bone density more normal.